I've been at the bedside of many people, including mayors and congressmen and et cetera, but I'd never been in the hospital myself. So this was my very first time being in the bed. But when I got to the hospital, a team of 3 doctors did come and speak to me at that point. So they began to inform me as to what was wrong, and along with the diagnosis, they gave me a prognosis, which was not very favorable. I had some questions and concerns. However, it was kind of settled. They said that this whole course would take 5 to 6 weeks, and that it was I shouldn't look for any time beyond that, 5 to 6 weeks. And it seemed at that time in the knowledge they were trying to get me to accept it. And I didn't have any problems with that. So my lowest point is when they were trying to convince me that I would be dead in 6 weeks, which that was 15 months ago. I was trying to get more information. And I was just asking questions as you would ask scientifically. Were your tests accurate? Are you sure there were no mistakes on the test? And I should state that as a behaviorist. I have a doctorate in behavioral science and a doctorate in theology, and I spent many classes teaching medical doctors bedside manners and how to communicate. It was really ironic or even sardonic that at this stage I was on the other side of that. And they wanted to make sure that while I was speaking to them, that faith was not something that would be interjected into the conversation. So with that knowledge, I was very saddened, but I accepted what they were saying and prayed over it. And what really made a difference is when Dr. Jajani came to speak to me. He didn't try to sugarcoat or anything or to make me believe something other than what the test was showing. But one thing he said that was really different, he said, well, wait until you go through your surgery and you get out of here and you come over to my office and we'll see what can be done. And then he said another thing, he said, we're going to do all we can do. And after we've done all we can do, then the rest is up to God. I digress a moment to say that I'm also national president of the United States Pastors Association, an association with 87,000 pastors. So one of the statements I would make before the pastors was that we're to do all we can do, and the results belong to God. So Dr. Jajani came in and said a very similar statement. So I felt very at ease and comfortable with him. And I was very thankful to God that he had sent a doctor that would do all he could and would not resent or try to eradicate my faith, but instead would say, I'm going to do all I can scientifically, and you can have all your faith. And we together would say, let God handle the rest. He said, because I was still dealing with a colonoscopy, he said that perhaps we should allow a surgeon to go in again. He said, because I don't trust the test, I know for myself. And of course, when I had the surgery with Dr. Lara, he looked inside and he did the biopsy, and certainly some of the tumors, most of them, were benign. And that was good, but he did find some, he said about a centimeter in size, that were still there, so there was still disease there. He started me back on this program to kill the remaining cancer or tumors that are there. I already knew again of his scientific abilities, his medical abilities, so I was glad to hear that. And then on top of that, he says, and we'll leave the rest to God. I was going to work on my third doctorate, another PhD. So when he started working on me, I asked him if I could go ahead and start to work on that, because I wanted to know with my chemo if I would still be okay to go and to the University of California and work on my third doctorate. And he said, there's no reason why you shouldn't. He says, just do that while we're doing the chemo. Again, always, he had very edifying words. You go ahead and do it. We're going to make it. He never did say anything that would make me think that I was not at a stage 4. He never said anything that would make me think that there was not a chance of the tumors taking off and attacking my organs, body organs, the liver, kidneys. He never said that there was not a chance of that happening. I knew the reality. He shared those with me. And he said, now having that reality, let's go from here and do what we can to make it, to do something about it and give you all the chances you can. And let's then trust God. So I've went away telling others that whenever I've dealt with cancer, and I still do chaplain work, and I still have people who come to me with cancer, and I tell them, I don't care if you're at City of Hope or any other place, Loma Linda, and I'm not knocking those places, by the way, because I've certainly done chaplain work at both the places, but I'm not knocking those, but I tell them what you really need to do is see my doctor, see Dr. Jajani, because you're looking for a chance. I think your greater chance of getting through this here and lasting as long as you can is to see my doctor.